This is for Anatomy and Physiology 2 with Professor Berlinger. Today we'll be covering the process of hemostasis. Hemo means blood and stasis means halting. Therefore, it is used in order to prevent an unsafe amount of blood loss. This process is commonly known as blood clotting or scabbing. There are 3 steps to hemostasis. The 3 steps are the vascular spasm, platelet plug formation, and the coagulation cascade. These processes seal the opening until the tissue has healed. Here we begin with the drawing of a healthy and non-damaged blood vessel. Meet Tommy. He likes apples, but has the unfortunate nickname Butterfingers. While cutting an apple with a sharp knife, Tommy lost his grip on the knife and cut his finger. Now we will go into depth how Tommy's body responds to the injury. When damage occurs to the endothelial wall of the blood vessel, the first step occurs by smooth muscle contracting, which then causes vasoconstriction. This limits the amount of blood flow to the site of injury by decreasing the diameter of the vessel. This drawing displays the tear in the smooth muscle wall of the blood vessel. The second step occurs when damaged collagen fibers are exposed to attract platelets that are flowing through the blood vessel. The presence of collagen activates platelets, making them sticky, to form a plug that temporarily seals the blood vessel wall. Activated platelets release chemical messengers and aggregating agents to cause more platelets to arrive to the scene. Examples of these include adenosine diphosphate, serotonin, and thromboxane A. The third step in the clotting process is known as coagulation. This reinforces the platelet plug with fibrin threads to effectively seal damage to the blood vessel. The process is driven by a cascade of plasma proteins, which are called clotting factors. Most of these factors circulate in the blood in their inactive form until they are mobilized. We are actually going to begin at the goal of this process and work our way backwards. To achieve stabilized fibrin, we need to convert fibrinogen, or factor 1, to its active form, fibrin. Fibrin sticks to itself naturally, so it cannot occur on its own in the bloodstream. This is why we have fibrinogen in our blood. To convert this fibrinogen to fibrin, we have factor 2A, thrombin, which is also activated from its inactive form, prothrombin, or factor 2. To activate thrombin, we need the presence of factors 10A, 5A, and calcium, which is signified by the yellow. This is where the cascade gets a little confusing. There are 2 ways to activate factor 10, known as the intrinsic pathway and the extrinsic pathway. The extrinsic pathway sparks the entire reaction and is initiated by the exposure of blood to tissue factor, or factor 3. The presence of tissue factor activates factor 7, which then activates a little bit of 10 to activate a little bit of thrombin. This is important because thrombin will get the intrinsic pathway going. Thrombin helps activate factors 5, 7, 8, 11, and 13, signified by the dotted arrows. In this way, thrombin causes an amplification effect, activating more factors to in turn activate more thrombin. Remember that the extrinsic pathway just sparks a little bit of this, but it is the intrinsic pathway that really gets most of the coagulation completed. Ultimately, the main goal of both pathways is to convert the fibrinogen to fibrin and produce a stable clot. If this were all there was to the story, the clot would continue to grow and grow due to all that positive feedback from thrombin. To counter this, there are negative feedback mechanisms. Coincidentally, these steps are also governed by thrombin. Thrombin helps create plasma to break down fibrin strands in a process known as fibrinolysis. Thrombin also stimulates the production of antithrombin. Antithrombin impedes the activation of thrombin, which will slow and eventually stop the cascade.